Sydney's frontline workers are right now preparing for a surge in hospitalised COVID patients as cases spike. Currently, 52 people are in hospital, 15 of those in the ICU, 5 requiring ventilation. For more, we're joined by infectious diseases physician from St Vincent's Hospital, Dr David Anderson. Thanks for your time this morning, Doctor. I mean, it's been a long time since we've had this many COVID patients in hospital. It is going to get worse before it gets better. Can the system cope?
Look, the system can cope, but what you have to realise is that winter is already our busy time. We already had, even before this COVID wave, unprecedented bed block across the state, and we are still doing elective surgery, and the COVID clinical activity comes on top of what's already an extremely busy time for the healthcare system. So we can cope and we will cope, but it comes at the expense of other activities that the healthcare system is meant to be doing, such as elective surgery. So if things get worse, some of those other activities need to get switched off to make intensive care beds and to make ward beds for COVID patients.
OK, and we have been told to prepare for it to get worse. We're expecting more than 100 cases to be announced today. What would it take to overwhelm the hospital system, you think?
Oh, look, we still have capacity, and I guess what we're seeing is that COVID activity is geographically still localised, so I think the system is capable of sharing that load around. If local hospitals in the centre of COVID activity are too stretched, we can start to spread that load around to other hospitals in the system. So I think we've still got capacity that we can utilise. It just makes everything we do less efficient, and it means we can't do our normal jobs. Basically, we can't look after patients with cancer, with heart attacks, with strokes as efficiently as we could if we weren't looking after COVID as well.
But to be clear, we're nowhere near that point at this stage, are we? Where you're having to pick and choose who you do and don't treat?
Look, I've had the luxury of a weekend off, but talking to colleagues who've been on call over the weekend, it has been an extremely busy time in the hospital. So in the end, those decisions about switching off things like elective surgery are going to be made at ministry level, not at individual hospital level. But if things get a lot worse, then I think that's the next thing to go.
Just looking at those who've been hospitalised, you've got 11 are under the age of 35, 2 in intensive care in their teens and in their 20s. Is this strain more than previous one impacting young people?
Look, I think part of that is a function of how we've rolled out vaccine. We've obviously appropriately prioritised the elderly, but that's meant that young people are substantially unimmunised. And I think we're now seeing that in our hospitalisation data. And that's not a reflection on young people. They simply haven't been given access to vaccine yet.
All right, thanks for your time this morning, Doctor. We appreciate it.